All right, good morning. It's good to see you on this beautiful Wednesday. I trust that you're doing well. This is my doctor. My name is Winnie Lubem, and of course, as always, it's a pleasure to have you on board with us. Now, today we want to talk about something that I'm pretty sure we all know or heard of, and that is on uterine fibroids. So you want to stick around till the end of the show and get to understand more on the same, because we've had people, or we know someone who has had or has fibroids, and of course we sort of understand their story a little bit as far as fibroids is concerned, but still on the same, there's so many misconceptions as far as fibroids is concerned. So you want to stick around again till the end of the show and get to understand more on uterine fibroids. If you have any question, you know the drill. By now, we're live, so that means you can call in anytime with your question. Or 791-478990 is the number to call through, or send us a text message 40920. We'll be looking at your questions in just a while. But for now, let me introduce my guest for today. Good morning.
Morning.
It's good to see you. You look lovely.
Yeah, thank you.
Thank you so much for making time for us today. On my doctor, before we get into the discussion, kindly just say hi to the lovely audience and tell them who you are.
Hello, everybody. I'm Dr. Sarita Sukhija. I'm an IVF specialist practicing at Fertility Point, Upper Hill. And we are going to, this is a very good topic that she has taken, talking about the fibroids. Because I'm from India and I moved here about a year back, and I'm seeing there are a lot of fibroids here in African women.
Yeah.
Yeah.
All right. And can you just talk then about, let's say, some of the cases that you handle mostly? Is it as common as we know the name from, or right now we're seeing a decline on the same?
I'm seeing the fibroids are very common in especially younger women here. And if we look at it, it mainly, you know, in married women, it can cause problems in conceiving. So it is very important to know, it is not always that the fibroids will cause problems, but there are certain fibroids which can cause problems in conceiving.
Okay.
Yeah.
And of course, we'll talk about it a little bit. Then can you just start then with the basics? Because I know most of the time we talk about fibroids here, fibroids there. Someone tells you, oh, I have fibroids, or the other person says, oh yeah, I know someone who has had fibroids before. So can we just start with the basics? What does it mean, really?
See, fibroids are basically an abnormal growth in the uterus, which is benign. Benign meaning it's non-cancerous.
Yeah.
So it's an abnormal growth which develops inside the uterus, and it can develop either inside the muscle, or it can be going into the cavity, or it could be outside.
Okay. Okay.
So that is known as fibroids. Because they are an abnormal muscle mass, they can cause sometimes symptoms, and sometimes they might not cause anything. It might be just an incidental finding when we are seeing the patients.
All right. Yeah. And when do we see like most cases of onset of fibroids? At what age do we see the cases mostly? Yeah.
It's usually common in the younger age group,
All right.
especially the childbearing age group, starting from 25 to 40, I would say.
Okay.
And the patients can actually, when they present to us for something else, then we find out that they have a fibroid.
Yeah.
So they are more common in the younger age group, and because they are hormone dependent. Women's body has estrogen and progesterone.
Yeah.
So the fibroids are mainly hormonal dependent. So that is the reason they are most commonly found in the younger women. And as a woman reaches menopause, so in the postmenopausal age group, as you know, the hormones decline. So that shrinks the fibroids automatically.
Okay.
Yeah.
All right. So then I think the big question is, which I think most people still struggle with, is why? And like we talk about, you know, the fact that, you know, during the reproductive age, that is when we see most cases of fibroids. But then again, the big aspect is then, do all women, or will all women of reproductive age get fibroids?
See, not all get fibroids.
Not all,
There are some women who are at higher risk.
Okay.
And those women are, as I told you, the younger women
Yes.
who have not had pregnancies. And it is actually said that the pregnancy is supposed to be protective of getting fibroids. So those who have not had children, they are at higher risk. Then women who are obese, they are at higher risk. women who have a family history of fibroids, like if your mother has a fibroid or your elder sister has a fibroid, then there are more chances that you will also have fibroids. So it is mostly genetic, or it's environmental or hormonal, or a combination of all these factors. There's no particular one factor which can pinpoint that you will have more fibroids.
Okay. And talking about women who've never had children, is then age a factor? Because we know, of course, as a woman grows, and then, of course, I mean, chances of her getting pregnant, of course, continue to lessen, especially after the age of 35. So suppose a woman hasn't had their child at what, let's say age 30, 32 there, are they more at risk of getting fibroids as compared to someone who is at, what, 25, 24, going below?
Yeah. It is seen that if a woman hasn't got pregnant by the age of 32, 35, then the chances of fibroids are more. And the patients who have had pregnancies, the chances of having fibroids are less. As I said, the pregnancy is protective. So it is seen that women who are not unmarried, or they have not had children, you know,
their first child, right?
Yeah. No child at all.
No child.
So they have unopposed estrogen and progesterone, which is being produced in the body that can stimulate the fibroids growth.
Okay. But in terms of then, what about those who, I mean, and I'm pretty sure you've seen cases like this, where let's say a woman had their first child at a younger age, like 19, 18, 17 going back, and then they would not wait for too long, but you see they're trying to raise this child, probably it wasn't planned, and then get, let's say, the second child at what, 30, so you see the spacing is a little bit big. So is that then, does it also predispose this one?
No, that doesn't predispose. Okay. It's only when the fibroids are there, they may be small, and if they obviously do not have children for a long time, then they might grow slowly. See, the fibroids grow very slowly. It takes a lot of time for the fibroids to grow, and then it depends where they are, whether they are in the uterus or they are in the muscle, and obviously, if their family history is there, then there is a predisposition to rapid growth also.
Okay. Yeah. All right. And what about those people who have like hormonal imbalance? You know, they struggle with this, and like you said, of course, women in their reproductive age are more hormonal dependent. Yes. So these ones, are they also more at risk of developing fibroids as compared to just
they are also people who have hormonal imbalance, like the PCO patients, they have very high hormones, and there is a hormonal imbalance. They are at higher risk of having fibroids.
Okay, then can we talk about the different types? I know you talked about dependent on where it is, the location of the fibroid. Does it have like different characteristics in terms of presentation? Because like you said earlier on, there's some people who would have symptoms and others would not have symptoms at all. So can you talk about the different types more in depth?
Yeah, so there are 3-4 different types of fibroids which are classified by the doctors where they are actually present. So I got this picture for the audience to understand clearly. See, this is the uterus, and you can see these are the fibroids. So the fibroids can be either totally in the muscle, in the uterine muscle wall, that is known as intramural fibroid. Then the fibroids could be partly in the muscle, and they could be partly pushing into the cavity. So that's known as submucous fibroid. Then there could be the fibroids which are completely outside. You can see there's no part inside the muscle. So these are known as subserous fibroids. Then you have fibroids which are the pedunculated fibroids, which are exactly pointing in the cavity. So this fibroid, they are completely outside. The baby is going to grow in this place. So if they are outside, they might not cause any problems. But if the fibroid is protruding into the cavity, it is occupying some space. So this can cause problem. Or the fibroid which is coming inside the cavity, it might not give enough space to the baby to grow. Plus what happens is these fibroids take away a lot of blood supply from the uterus. So the blood supply to the area where the baby has to grow, that decreases, and that can lead to either no pregnancy, or even if the pregnancy happens, it could
It
end
will
up
not
in
survive.
miscarriage.
Yeah.
So these are the different kinds of fibroids, and based on the symptoms and what the patient wants, and whether she wants to preserve her fertility, based on that the treatments are offered.
Oh, okay. And can we just talk about them like just one by one in terms of which one, so of the four that we've talked about, which one is more common? Do we see it, the ones that are inside or outside?
See, if we talk about the prevalence, which is more common, they all are equally prevalent.
Okay, okay.
So we see patients who have a big fibroid, but because it is outside, so it might cause little pain, or it might cause little heavy bleeding. And if the patient is young and she has not conceived, she comes to us with the complaint that she has not been able to conceive. Then we find out, or if somebody comes with the complaint of recurrent miscarriages, like she is getting pregnant but every time it aborts. So then we try to find out where exactly is the fibroid.
It is, yeah.
But the frequency of the fibroids, the kind of fibroids, it's equal.
Okay.
There's nothing particular that some women will have
Get,
this.
yes.
Yeah,
All
so-
right. And in terms of, so which ones do, and again, talking about them just one by one, in terms of the symptoms, because for instance, the submucosal, and the intramural, fibroids, can we talk about their symptoms? Because they are more inside as
Yeah,
compared
yeah.
to the other ones, yeah.
So, see, basically they increase the area of the uterus from
Okay.
where a woman will bleed. So, it can cause excessive bleeding.
Bleeding, okay.
It can cause pain in abdomen.
All
It
right.
can cause cramps. And a woman may have heavy bleeding with clots. When it causes these kind of problems, then we need to look into it.
Okay. And is it still on bleeding? Just a little bit before I lose the question. Does the bleeding occur during their menses, the heavy bleeding with
Yeah.
clots, or does it just come? I mean, menses or not, it just comes.
No, it is usually during the
their menses,
periods,
okay.
and the periods are heavy, and obviously they come frequently also. And women who have fibroids inside the cavity, they can have intermenstrual bleeding also. Apart from the periods, they might have bleeding in between for 2-3
yeah.
days.
Okay.
Then we usually suspect that there could be a fibroid in the
Right.
cavity.
Okay, okay.
And then if we talk about the fibroids which are outside, see, if they keep on growing, then they can press upon the organs which are near
Yes.
to them.
True.
So if there is a fibroid which is anterior, just close to the bladder, it can push on the bladder, and the woman can have difficulty in passing urine.
Yes.
Then if the fibroids are on the posterior wall, means behind, so there the rectum is closed, so it can press upon the rectum,
Yes.
and a woman can have difficulty in the
In
passing stools.
Yeah.
And if they are too big, occupying the pelvic region, then the woman can have difficulty in having intercourse.
Yeah.
It could be painful. So it depends, where the fibroids
Where the
are
fibroid is,
present and in which direction they are growing.
Okay.
Based on that, the patient can present with the symptoms.
Okay.
Sometimes we see the fibroids go unnoticed, and a woman comes with that she can feel something in the abdomen, there's a lump. So it might not cause any problem. So
Okay.
the symptoms do not actually depend upon the size. It could be it could be small, and if they are multiple, it's not only that they can have 3, 4, 5
multiples, yeah,
fibroids.
Yeah.
And
in
then-
different locations at the same time.
Yeah.
Wow. Okay.
So if they are small, but there are many, and they're causing symptoms, then it will require treatment. And if it is even big and it is not causing any symptoms, but more than 5 centimeter fibroids, we usually say that you should take active treatment for that.
Okay, regardless of where it is.
Yeah,
Okay, because most of the time we see people who, I don't know, you will tell us if this is more on the myth side as compared to being, true, where, because I know of a person who was pregnant and then she delivered, and then her tummy was still big. And you see, what she was telling us is she has fibroids. So most of the time she would say that she has been advised to get pregnant so that the fibroids disappear. So I don't know if that is more of the myth or it's true.
No, it's a myth actually.
Okay.
If you get pregnant with the fibroids, see, in pregnancy your hormone levels are going to go higher.
True.
So the fibroids will also grow along with the pregnancy. And because of the fibroids, you can have problems in the pregnancy. Like it is seen that the patients who have fibroids and they get pregnant, there are more chances of preterm labor, premature rupture of membranes, and there could be placenta abruption. So there could be many problems. So they need a special and a specific kind of a care so that they don't end up with the problems.
Yeah. All right. And of course, we'll talk about the complications a little bit more in depth a little bit later. But for now, the aspect of pain and cramps. You see, during menses, of course, there's that aspect of cramps. But when one has fibroids, and especially when you don't know, because most of the time there's some people with fibroids and they don't really know that it is fibroids. And even during the menses that come, in between, then so how different is the pain or the cramping from the normal cramping that we always feel, during the menses? Is it more painful? Is it more, does it come on and off? And is there a specific location where you feel the pain more as compared to the others?
See, the pain is usually severe, and it is actually more than what a girl would get when she has menses.
Yeah.
And along with the pain, the bleeding is heavy, which is like usually a girl would require to change 3 or 4 pads. But with the fibroids, you will see every 2 hours, the bleeding is so heavy that she needs to change the pads frequently. And also nowadays, because we have so many diagnostic modalities available, so it is always advisable when the pain is too severe and so that it is interrupting the day-to-day life of a girl or a woman, then they must see a doctor. So the fibroids can be easily seen on the ultrasound. It's not an invasive thing. So you get to know what is the reason of the pain and heavy bleeding.
Okay, all right. Because and people say pain is relative. I mean, there's some people who are able to handle, pain more as compared to the others. But like you said, of course, other accompanying factors like the heavy bleeding, then one needs to go and just get checked to ascertain what exactly it is. Okay, so in terms of the size, you talked about the fact that it grows, so it's not like just something that just comes one day and then all of a sudden it becomes big. It grows over time. So at what interval does it grow, and the speed at which it grows? Is it different depending on the location that it is?
Not on the location. I would say the growth depends actually on many factors that, as I told you, if somebody is in younger age group, their hormones are active, then people who are obese, and we have seen that in African American women, the growth of fibroids is quite rapid as compared to the white or the Asian population. And it is also seen that once they enter the menopause, the fibroids would shrink faster in white women as compared to the African woman. So we need to see actually depending upon the symptoms, and so we advise usually once if you have seen ultrasounds, once you have seen the fibroids on the ultrasound, then they should get the ultrasound repeated at least every 6 months to see that the fibroids are not growing rapidly.
Okay. And do we have cases of people who have the fibroids and then it just disappears without even them knowing that they've had fibroids and without showing any signs and symptoms?
Yeah, see, as I told you, all the fibroids are not symptomatic. So sometimes one can have fibroids which are just lying silently in the uterus, and they're small in size. So if they are not causing, if we do ultrasound, then I would see maybe 70 to 80% of the women will have fibroid here and there, small ones. If they are not causing any problems, then there is no need to remove them. Just let them be. But yes, if they are causing problem, then it needs attention.
It needs attention. Okay, so then in terms of, does it increase a person's chances of getting uterine cancer?
Sometimes, yes, if there is a family history of cancer, and especially the fibroids which grow very rapidly, there can be some cancerous change in those fibroids, which can again be detected on the ultrasound as well as MRI.
Okay, and but you see, most of the time, I mean, we, as women, I mean, as a population in general, we don't look at the preventive care. Mostly we look at curative, in that one might not go and get, let's say, get screened, go for ultrasounds. As long as they're feeling fine, we just don't.
Okay,
yeah. So would you advise one to go for, I mean, or are there screenings available, especially for fibroids and, anything like that? And if so, is it free or one has to pay?
No, one has to pay. Obviously, I think in government hospitals, you can avail at free facility, but I would say it's not that expensive. For one's health, I think one should just get yourself checked, especially if you are having trouble like pain or any other symptoms. So the ultrasounds are easily available now, and we can usually detect it very easily. And it's not expensive.
Okay. It's worth investing in. Okay. At what age would you advise one to have their first screening or ultrasound?
I would suggest if there is a family history, then it should be early. And like I would suggest maybe in the age group of 18 to 20 years, one should have a scan. And if a person doesn't have any family history of fibroids, then if there is no problem, then obviously nobody would want to get it screened. So 20 to 25 years of age group, especially I would say in your country, in Africa, it's very common. So it's always better to get it screened.
Okay, all right. But then again, some people might ask, is it really necessary? Because, like you said, there are aspects where it doesn't cause any problems. It's, I mean, it's asymptomatic, so one might not really know. But is it really necessary to go and get the ultrasound, especially where there are no cases of pain, nothing like that?
Yeah, that's what, see, it depends. If somebody is young and they don't have any symptoms, then it's okay. But usually by the age of 20, 21, 25, when a girl gets married, and if she has problems in conceiving, most of the common symptoms that we see when they are not able to conceive, then they come to us, and then we see that there are fibroids. So if in 1 year of actively trying for a pregnancy, if a girl is not getting pregnant, then one should see the doctor, and fibroids could be one of the reasons, especially if they are coming into the cavity.
Okay, so we're going to take a very short break, but when we come back, I would want to understand cases of contraceptives and fibroids, because we've had so many stories associated with the same, where people say if you start taking contraceptives early, which is something that we see now, chances are you might get fibroids and of course might end up causing problems, getting a child. So we want to know, is this true, is it not? And so many other questions as far as diagnosis and treatment of the same, because you said of course various treatments are available. So if you have any question, feel free to call us live. 0791 478 is the number to call through, or send us a text message on 40920. We'll be looking at them after this very short break. Stay with us. All right, welcome back. Glad you're still with us. This is My Doctor. And of course, our focus today is on uterine fibroids. And like we said, it's not all women that get, but of course, women in their younger age, and of course, with other factors, as far as genetics is concerned, are more at risk of getting intrauterine fibroids. So before we went for break, of course, there's that aspect of contraceptives and fibroids? Because we hear so many, I mean, there's so many stories out here, which I'm pretty sure you've also had, you know, as far as contraceptives is concerned. And one of them, like I said, is if you start contraception earlier, then chances are you'll get fibroids later on. Is this true or not?
No, I would not say that it's true.
Okay.
In fact, you know, the oral contraceptive pills is one of the medical treatment
for fibroids.
Yeah.
Okay.
Because when you take contraceptives, it suppresses ovulation.
All right.
Right?
All right.
So it suppresses your hormones. So it might be one of the treatments. Although not very commonly used, there are better treatments available. But it doesn't increase the chances of fibroids.
Okay.
It's protective, in fact.
Okay.
Yeah.
But what about this? Because we know, I mean, we understand there are different types of contraceptives, others hormonal, others not. So even there, so oral, no, this one is more on the protective side. What about the other types?
The other ones also, then like the multi-load IUCD, that is also again, it is not seen that it increases the chances of fibroids.
Yeah.
In fact, there is a progesterone producing intrauterine device, levonorgestrel, which is commonly known as Mirena. That is inserted into the uterus to regress the fibroids because it's a progesterone producing intrauterine device.
Okay.
So again, that is not increasing the chances of fibroid.
Okay.
They
So
are
short
protective.
contraceptives does not increase
Yeah.
a person's chances
Yeah.
of
No,
getting
not at all.
contraceptives.
Not
Okay.
at all.
All right. Very important for us to demystify that myth. And before we talk about diagnosis, can we talk about then, because you talked about earlier about an instance of lower back pain, and women complain about lower back pain on so many times, so many levels. Others will say theirs is on and off. Others will tell you it's consistent, it doesn't go away. So as far as one being a symptom for fibroids, how does it present itself, especially the lower back pain? Is it on and off? Is it more sharp at some point and then disappears, or is it consistent?
See, the back pain, the patients will have usually who have fibroids on the posterior wall. Posterior wall means back side of the uterus. So they might press on some nerves, which can cause pain. They might press on the rectum, that can again cause some pain, and it depends upon the size. If it's a small size, obviously it is not going to occupy much space, but if it's a bigger size, so it's going to press upon a lot of things.
Yeah.
So that causes pain. So the patients can have a lot of back pain, and along with the cramps, of course, during the periods, and also they can have difficulty in intercourse.
Yeah.
So all these things, if they are present, then we specifically look for the fibroids in the posterior wall.
Okay.
Yeah.
And just out of curiosity, can it get to a point where, it's to begin pressing so much that it can get to the spinal cord? It's
No,
very, very sensitive.
it's very rare. It's very, very rare.
Okay.
It's
Okay.
very rare.
All right.
There are a lot of structures in between.
That protected.
Yeah.
Okay. All right. Then can we talk about the diagnosis of the same? We talked about some of the signs and symptoms earlier on. So let's say one goes to a hospital and just to just see what's going on. What usually happens?
So for the diagnosis, the most commonly used modality is the ultrasound,
Okay.
which is easily available. On the ultrasounds, we can see the different types of fibroids,
All right.
especially with the 3D ultrasound available. You can actually make out on the 3D ultrasound whether the fibroid is completely in the muscle, or it's outside, or
Okay.
it's pressing inside the uterine cavity.
Okay.
So that is one good modality. Then the fibroids can also be diagnosed on MRI. That we suggest if a woman has many fibroids and if she's planning to go for the surgery. So that we basically say that for the exact mapping of the fibroids, where exactly is the outline. So
Okay.
MRI clearly shows you where exactly is the fibroid.
Okay. And then, so once are there things that sometimes might mimic fibroids that might be picked by the MRI, but at the end of the day, it might not be fibroids?
So see, the fibroids are only in the uterus.
Okay.
So there is no other thing which will mimic the fibroid, except, you know, the symptoms can mimic.
Okay.
If there is a cyst in the ovary or if there is any other abnormality like endometriosis, that can cause pain, that can cause heavy bleeding.
Yeah.
But on the ultrasound, we can easily pick out whether it's a cyst or it's a fibroid.
It's a fibroid,
Yeah,
okay.
yeah.
So more on the symptoms as compared to,
Yeah.
to the diagnosis. Okay then, so fine. So can we talk about then the treatment options for the different types of fibroids?
Yeah. Yeah, so see, the treatment depends upon various factors.
Okay.
One, if the patient is young, if she has symptoms, if she wants to preserve her fertility,
Okay.
and if she doesn't want to preserve her fertility. So the treatment modalities will depend upon all these factors. Now, if the patient is young, and she is just incidentally diagnosed to have fibroids and she has no symptoms, then nothing needs to be
It's
done.
done. Okay.
Just do a regular surveillance.
Okay.
And
okay, can we answer that a little, because we have a caller on the line. Good
Yeah.
morning.
Morning, how are you?
Good. Thank you so much for calling us. Do you have a question?
Yes, I do.
All right, go ahead.
I've been married for 1 year now, and I've been having difficulty in conceiving.
Okay.
And when the doctor talked about the back pain and everything, I've been feeling this for, let's say, a year, 6 months now. And I don't know if this is a cause of asthma. If this maybe can direct me to, I don't know how to do it. Inawezekana kwamba, can I use Swahili?
Sorry?
Can I use Swahili?
Oh yeah, please,
Yeah, yeah.
go ahead.
Okay. For me having this back pain,
Back pain, huh?
inaweza kuwa kwamba iko na uhusiano na uterine fibroids or something.
Okay. So you said you've had...
And for me staying for this long without conceiving,
You've stayed long without conceiving. Hello?
I think it got
I think
disconnected.
we have a problem on the line, but please call us back or please send us text message, because what I got is she's been married for a year and she's had back pain, so she's concerned, can this be related to uterine fibroids? I didn't quite clearly get the rest of the question, so I think my director producer can help me with this, but that is what I got so far.
Yeah, I think if she is married and if she has got back pain, it is better that she goes and sees a doctor, a gynecologist, and get a thorough checkup done, on which if there is a problem, we can sort it out.
Okay.
Yeah.
All right. And of course, yeah, for the rest of her question, I think we'll need to get to get it
Yeah,
so
yeah,
that we
yeah.
can
That's
be able
okay.
to answer her correctly. But you were talking about then the treatment
Part,
options.
yeah.
Yes.
Yeah. So as I said, if the woman is young, no symptoms, nothing to be done, just tell her that you have fibroids. In case you have any problems later on,
Okay.
then we can sort it out. Now, if the patient is young and she is not able to conceive, she obviously wants to have a child and she presents with fibroid, then we need to see where exactly is the fibroid. So, and also the size. If it is more than 3-4 centimeters and if it is protruding into the cavity, then it needs to be taken out by a procedure known as myomectomy.
Okay. Okay.
If the woman is young and she has symptoms, but she is not recently planning to have a baby, then in those cases, we can first try the painkillers, the normal NSAIDs. Then we can, if the fibroid is say 4-5 centimeters and it is causing symptoms, then there are injections available like GnRH analogs. Those are the injections which are given once a month, but we cannot give it more than 6 months because it causes bone loss. So for a short duration of time, like when either the patient is waiting for the surgery or she wants to postpone the surgery, she wants a pain relief, then we can put them on injections.
Okay.
And if we need to give it more than 6 months, then we have to give them Advec therapy because it can reduce the hormones. Then after 6 months, if the fibroids are growing still, then they need to be out by surgical method. Then there is this Mirena, which I told you, levonorgestrel intrauterine system that can be put inside the uterus. So these are the medical things which are available.
All right.
Then there are surgical but non-invasive. Like we have uterine artery embolization procedure, which is done under the radiological guidance, in which polyvinyl alcohol particles are inserted into the arteries to block the supply of the blood supply of the fibroids. See, the fibroids survive on the lot of blood supply which is coming from the uterine artery. So we block the blood supply. That is known as uterine artery embolization. Then you have a very latest technique, which is MR, magnetic resonance guided focused ultrasound. So it's a non-surgical again. Through the MRI, the ultrasound waves are focused to get the fibroids necrosed. But that is available in very, very few places. I don't know if it is available here.
In Kenya.
Yeah. And then the other treatment modality is the surgery, in which we can either do a myomectomy, which can be done through laparoscopy, or even one can do the fibroid removal through the uterus, which is known as hysteroscopic myomectomy. So the patients obviously who want to preserve fertility, we would, and if the fibroids are causing problems, then we must remove them. Or if they are not too big, they can be shrunken with the giving injections. Now we have the tablets also available for the younger girl, which is a very, very recent one, that is ulipristal acetate. And it can be given once a day, 5 milligram for 3 months. And there has been significant reduction in the fibroid size, which has been seen. So every 3 months, we give a gap of 1 month, so they can keep on taking it so that the fibroids don't grow. So there are different modalities available, and we need to see what age the patient is, what are the symptoms, and if she wants to preserve the uterus, if she is looking at having babies or not having babies. Accordingly, we have to formulate a treatment chart for her. Suppose if somebody has completed her family, she has completed the children and the fibroids are giving too much of trouble, pain, bleeding and all those things. Then she says, I don't want to keep the uterus. So she can be offered hysterectomy, like uterus removal, either through laparoscopy or open, whatever. But it is preferable to offer a minimal invasive surgical procedure. So then once the uterus is out, the fibroids are out.
But then again, does one have to go through a lot of counseling for that? Because you see, most of the time people think that they are done having kids. Others, let's say, are 100% sure they do not have kids. But you see, that thought of having your uterus removed is pretty intense and pretty difficult for most people. So, of course, do they have to go through some sort of, counseling to just help them really understand what they're about to get?
Normally, I would suggest by the age of 45 or 50, if somebody has fibroids which are giving trouble, then usually we prefer to go for hysterectomy. But if somebody is younger, then we can just remove the fibroids by doing a myomectomy. That's okay.
All right. Now we have a question here. Her name is Winnie. She gave birth when she was 16. And then she's much older now. She hasn't specified how old she is right now. But she said last year, she's trying to conceive. And then last year she was told she has cervical fibroids. So her question is that what is preventing her from getting or conceiving?
Yeah, cervical fibroid again can cause difficulty. It is again, it's cervical. This is the cervical area. So if the fibroid is coming here, it's actually obstructing the passage of the sperms to move upwards and fertilize the egg. So again, the cervical fibroid needs to be removed because it is exactly in the at the place where the sperms have to move. So it can, by mechanical obstruction, it can cause infertility.
Okay. Are there things like preparations she has to make before going for the, like what usually happens before one, gets the surgery?
Yeah, before the surgery, we obviously need to exactly find out the size on the ultrasound or MRI. Then some blood tests are required for the fitness for surgery, routine X-ray, ECG, etc. And the other important thing that we see is because of the fibroids, a woman may be bleeding too much, so her hemoglobin level falls.
Yeah.
She may have anemia. So 8 to 9 gram is what we look at before taking up the patient for surgery, because during the surgery also there might be some blood loss.
Sure.
So they need to build up their hemoglobin before going in for the surgery.
Okay. And then even before one gets their treatment, because we know of some people who have lived with their fibroids, let's say, for a very long time. Some might not cause problems, which, like you said, that's fine. But for others who, let's say it's causing problems and they're not either financially stable yet to get the treatment that is appropriate for them, when you talk about then sort of like the management of the fibroids before they go for treatment?
Yeah, so as I told you, if they are planning for finances or for any other reason, if they have to postpone the surgery, they can take these tablets or they can go in for injections. Which can be given every month, which will prevent the increase in the fibroid size. But one must remember, as soon as they stop the injections, the fibroids might come back to the same size again. So the tablets, the injections, or even Mirena inserting into the uterus, that can prevent the rapid growth of the fibroids till they are waiting surgery.
Okay. Yeah. All right. And then another question here. This one says, hi, I do not have fibroids, but I have never conceived for 4 years. What are the other causes of infertility?
Yeah, so see, for the infertility, we have to look at a lot of causes. In the female, there could be problem in the ovaries, that she is not producing eggs, so she can be given some tablets so that she makes eggs. Then the other thing could be tubal factor. So if the tubes are blocked, then again she cannot have a natural pregnancy. So we need to check the tubes. There is a special test known as HST or SST by which we can check whether the tubes are open or blocked. And then, of course, on the ultrasound, we can make out a lot of things. If there is endometriosis, or if there are fibroids, if there is polycystic ovary. So these are all the things which we need to find out where is the problem. And along with this, we also check the thyroid as well as prolactin hormones, which can affect the egg quality. So there are a lot of things which we need to check for a female. And apart from the female, we also need to check the male part. So we ask for a semen sample analysis, and we look at the counts, the motility, whether the sperms are normal or abnormal. So it is we need to investigate both the partners, and we need to exactly find out where is the problem. And then we can treat it. So it's not only the fibroids, there are many things which we need to see.
Okay. All right. And then remember the question that we answered, Winnie, who gave birth at, 16, her first child, and then she's trying. She's just sent a clarification and says it wasn't cervical fibroids, it was pelvic fibroids. So again, is this what is preventing her from getting a child?
The pelvic fibroids?
Yes.
Yeah, so it depends again if the fibroids are big. As I said, if they are more than 3 centimeters, or if they are too many in number. And even if they are small but too many in number, that can also divert the blood supply of the uterus towards the fibroids. So the implantation gets affected. So also we need to see if the fibroid is coming into the cavity. So we need to take it off. So we need to see exactly for the fibroids. If they are big, then they have to be out.
They have to be removed.
Yeah.
Okay, and then this one says, I am married for 4 years, but niliambiwa both fallopian tubes are blocked. How can I unblock without operation? Please help. I need a child.
See, there is no way you can unblock the tubes
yes.
without surgery.
Yes.
And sometimes even with the surgery, when we try to unblock, they are so badly damaged. The tubes are very thin. And if because of some pelvic infections, they have become hard and they are damaged to so much extent, even at the time of surgery, we cannot open them.
Yeah.
So unless we go inside and see if they can be opened, there's no medicine which can open the tubes.
Yeah.
And if the tubes are blocked and if surgically also they cannot be opened, then the only option left with the couple to have a child is through IVF. So IVF is and also IVF, if the tubes are blocked at a younger age group, the IVF results are very good.
Okay.
So they should keep in mind that if they really want to have a child, they should not postpone it, because as the woman ages, her egg quality and as well as the number, both goes down.
It goes down, true.
So it affects the IVF results also.
Okay. All right. So surgery, unfortunately, is the only
is the only option. Yeah.
Okay. And then this other one says, I was diagnosed with right side ovary cyst, measured 4 centimeters. I have severe low right abdomen. I think it's abdominal pain. So her question is, does it need to be removed?
4 centimeter, you said. Yeah, if it is 4 centimeter, we can try giving the medicines for 2 to 3 months, and then we can follow it up on the ultrasound. It might reduce, because less than 5 centimeters, we usually do not suggest to operate. We try to shrink it with the tablets. But if with the tablets, if it is not going and if it is increasing in size, then we need to take it out surgically.
Okay. All right. And then we have another question. Vanessa, my producer, will have to help me with this. So this one, the person is called Helen. She's had fibroids for 13 years. And then in 2004, she conceived, I want to believe. And then 2 years later, she got pregnant, but she had a miscarriage. So her question is, could this be related to
again it depends where the fibroid is. If the fibroid is occupying the cavity where the baby has to grow, then it can cause miscarriage. And if it is coming into the cavity, then it needs to be removed.
It needs to be removed. Okay. And then have we answered this one for 4 centimeters? Yes, we have.
Yeah.
Okay. And then remember Winnie again came back, and then her clarification is it's 3.7 centimeters oval and it's only 1. So
the fibroid?
Yes. Does it have to be removed?
If it is not causing any symptoms, if it is not in the uterus, if it is outside, then it's okay. She doesn't need to remove it. But if it is causing problems like pain or heavy bleeding, then of course, yes, we need to think about it.
Remove it. Okay, so we have to end the show like right now. So can I get your parting shot very briefly? As far as fibroids is concerned, is there a way that we can prevent, cases of onset of fibroids? Very, very briefly.
There is actually no particular thing which can prevent fibroids.
All right.
So I don't think we can do. I think just maintaining a healthy lifestyle, avoiding too much of meat, eating green vegetables, green tea extracts, avoiding too much of stress, and because there are a lot of things we exactly don't know what causes fibroids. So just maintain a healthy lifestyle, and because mostly it's genetics, so there is not much we can do to prevent it. The only thing is, if you have problems, then go to your doctor and get it treated as early as possible.
Don't wait. All right, thank you so much for coming by today. Really, really appreciate your time, and thank you so much for answering our questions as far as fibroids is concerned. And thank you so much for staying with us as well until the end of the show. I believe that you've learned a lot as far as our uterine fibroids is concerned. So my name is Winnie Lubembe. On behalf of an amazing team who put together this show, we wish you a lovely day ahead. Thank you so much for your questions. We'll see you again next week on Monday, same time, same place. If you missed the first part of the show, you can watch the repeat later on tonight at 10:30 p.m. or alternatively catch the full episode on our YouTube page, and that is on Ebru TV Kenya. Goodbye for now. God bless. See you next week on Monday.